is Dania. I am a nursing student at Chamberlain University, and this video is for my health assessment class. This is Jordan. He's volunteering for this video. Are you consenting to do this video, Jordan?
Yes.
Okay. So we're gonna go ahead and start this head to toe assessment video. I'm gonna start by knocking on the door, washing my hands, and providing the patient with some privacy, closing up the curtain. Sir, my name is Dania. I'm gonna be your nurse doing a head to toe assessment video. I'm gonna start by getting your name and your date of birth, please.
My name is Jordan, born July 12th, 1994.
Okay. And do you know why you're here?
Yes, for a complete head to toe assessment.
And do you know where you're at?
In the clinic.
And do you know the date of today?
Yes, today is the 13th of October, 2019.
Okay, so patient is alert and oriented ×4. Patient seems to be dressed appropriately for the occasion. Patient seems to have a relaxed position. Patient's no acute distress at this time. Patient looks clean. Patient hearing looks intact so far. So, skin color seems to be appropriate for patient's ethnicity. I'm gonna go ahead and palpate your head. So I'm palpating your head, and upon palpation, I'm looking to see if you have any lumps or masses. No lumps or masses noted upon palpation. There's no bugs. There's even distribution of hair. Did you feel any pain when
Nope.
I was touching you? Okay, so patient has normal cephalic. I'm gonna go ahead and assess your eyes. So right now, patient has about 3 millimeters on the pupils. So let's see what happens when they see light. So they constrict to about a 2 bilaterally. Both eyes are symmetrical to each other. There's no discharge coming out of the eyes. The sclera looks white. There's no discoloration there. The nose of the patient looks midline. There's no deviated septum. There's no drainage, no discharge coming out of the nose. Sir, I'm gonna have you close one nostril to check the patency of the airflow. Give me a sniff, and then let's do the same with the other one. Okay, so airway patency seems to be intact. I'm gonna go ahead and check your ears. There's no discharge here. No discharge. Do you feel any pain?
Nope.
No pain. They both seem to be symmetrical to each other. I'm gonna go ahead and assess your mouth. Can you please open your mouth, sir? Can you say ah? Okay, so uvula rises upon patient says ah. Soft palate rises when the patient says ah. Uvula is midline, tongue is also midline. Teeth look clean. There's no cavities or anything noted, and it looks pink and moist as well. I'm gonna go ahead and palpate for your TMG. Can you open your mouth, sir? Okay, so that's palpable and it seems to be intact. I'm gonna check your neck. Can you give me range of motion? Move it all around, okay. I'm gonna check your trachea to see if it's midline. Trachea seems to be midline. I'm gonna go ahead and palpate your tongue, your lymph nodes. So I'm gonna start with preauricular, postauricular, tonsillar, submandibular, submental, and occipital. Okay. All right. So and now I'm gonna assess the upper body. So I'm gonna assess your upper body. So I'm gonna go ahead and touch. Temperature seems to be warm, but patient doesn't seem to have a fever. There's no scars noted, no open wounds, no skin abnormalities. Skin seems to be intact. Gonna check for capillary refill. Capillary refill is less than 2 seconds. Less than 2 seconds bilaterally. I'm gonna check your pulses. So I'm gonna do your brachial pulses. Okay, they're a +2 bilaterally. Gonna check your radial pulses. Okay, radial pulses are a +2 bilateral, and your ulnar pulses. Okay, ulnar pulses are a +2 as well bilaterally. So all pulses are equal, which is good. Now I'm gonna go ahead and assess your lungs, lung sounds and everything. Patient doesn't seem to be using any accessory muscles. Patient doesn't seem to be having trouble breathing. No shallow breathing notice. Do you feel any trouble breathing?
No.
No. Okay, so I'm gonna go ahead and assess for the breath sounds. I'm gonna auscultate your breath sounds. Just give me a deep breath every time I touch you with my stethoscope and exhale through your mouth, okay?
Okay.
Now I'm gonna check the back. Give me a deep breath. Okay, so all breath sounds are clear. There's no adventition sounds noted, which is good. Everything is normal. Now I'm gonna move forward to the heart. I'm gonna be auscultating for heart sounds, see if I can hear any murmurs or any abnormalities. Sir, do you mind if you raise
No,
your
I don't
shirt? Okay. So I'm gonna be checking for any murmurs at this time. Okay. Okay. So second intercostal space, right sternal border, it's gonna be the aortic. Okay. Okay. Second intercostal space, left sternal border is gonna be the pulmonic. Third intercostal space, left sternal border is going to be the Earth's point. Fourth intercostal space is going to be the tricuspid. And the fifth intercostal space, mid-clavicular, is going to be the mitral valve, which is where we can also auscultate for the apical pulse. And I'm going to go ahead and do that right now. And the apical pulse should be measured for over 60 seconds. Okay, after 60 seconds, patient apical pulse was 65. Okay, sir, so no murmurs were noted. Everything seemed to be okay. Do you have any questions so far?
Nope.
Okay, so I'm gonna go ahead and have you lay down. Okay, so now I'm gonna move forward into the abdomen. And first I'm gonna start by auscultating, listening to hear if I hear any breaths, any abdominal sounds. Gonna start with the right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. So bowel sounds are present. So patient abdomen looks flat, no lumps or masses noted so far. I'm gonna percuss. Okay, so upon percussion, it was dull, and now I'm gonna palpate. So if you feel any pain at any time, please let me know.
Okay.
Any pain so far?
Nope.
Okay, so no pain. When I palpated, I didn't feel any masses either. So that seems to be intact as well. Now you can go ahead and sit up. And I'm gonna check your lower body, check to see if there's any abnormalities here. I'm gonna touch you. I'm checking for your temperature. Temperature seems to be fine. I'm looking for any skin abnormalities, any open wounds, any scars. There's no abnormalities noted. Skin seems to be intact. I'm gonna check for your pulses. So I'm gonna check for your pedal pulse. And now the anterior tibial pulse. And they're both a +2 anterior tibial. And the pedal pulses are both a +2. They're intact bilaterally. I'm gonna check for capillary refill here. They're less than 2 seconds. Okay. I'm gonna check for any edema to see if the patient has any edema, accumulation of fluid anywhere. There's no accumulation of fluid here. Can we see if you have any accumulation of fluid? Okay, everything seems to be intact. Now I'm gonna check for your strength and your gait. So I'm gonna have you stand up. And I'm gonna have you walk from here to over there and then just walk back. Okay, and now I'm gonna have you stand here, close your eyes. Okay, so patient seems to have a steady gait. So patient passed a Romberg test. Now I'm gonna have you with one finger touch your nose. And let's do the same thing with the other one. Okay, so patient passed the finger to nose test as well. Everything seems to be intact. I'm gonna have you sit down now. And I'm gonna check for your strength. So would you mind putting your arms like this? I'm gonna push and then I'm gonna pull, okay? Okay. I'm gonna do the same thing with your legs. Okay, so patient strength is 5. All upper body and lower body, patient strength is intact. Patient's very muscular, and that's it. Do you have any questions regarding this assessment or any findings, sir?
Nope.
Okay, so that would conclude our head to toe assessment, and I just want to thank you for participating on this video. Okay, so I'm gonna go ahead and document my findings, wash my hands. If you need anything, let me know, okay?